Assalamu alaikum wa rahmatullahi wa barakatuh. There is no clear evidence on whether large cysts like periapical lesion and radicular cyst can or cannot heal after non-surgical root canal therapy. These lesions can only be diagnosed after surgical biopsy, making pre-treatment identification difficult. Evidence suggests radicular cysts may regress through apoptosis, but true cysts are believed to be self-sustaining and may require surgical intervention. These are the points that encouraged the author to write this review, titled as Non-Surgical Root Canal Therapy of Large Cyst-like Inflammatory Periapical Lesion and Inflammatory Apical Cyst by Lin, Andricucci, and Risenberg, published in Journal of Endodontics in 2009. Aiming to examine the potential for regression of large cyst-like periapical lesion and apical true cyst after non-surgical root canal treatment. They started with pathogenesis, histology, and biology of inflammatory apical cyst. Apical cysts are pathological cavities lined by non-keratinized stratified squamous epithelium and developed as a part of apical periodontitis. They originate from the proliferation of epithelial cells rest of Malaise. The cyst lining is infiltrated by inflammatory cells, with epithelial proliferation linked to the degree of inflammation. Unlike a neoplastic lesion, apical cysts lack malignant features, and according to the WHO, apical cysts are classified as inflammatory, non-neoplastic lesion driven by hyperplasia, which is self-limiting and reversible upon infection control. Large cyst-like apical periodontitis lesion regress after non-surgical root canal therapy through three key mechanisms, which are apoptosis, inflammation control, and bone regeneration. Decompression or partial cyst opening aids this process by evacuating irritants, reducing pressure, and promoting healing, while surgical debridement achieves faster result. Non-surgical root canal treatment supported by biological debridement ultimately produces comparable long-term outcome as macrophages clear bacteria and damage tissue. The concept that apical true cysts are self-sustaining indicate they cannot heal with non-surgical root canal therapy, but evidence suggests otherwise. True cysts, unlike pocket cysts, are separated from the root canal system, but inflammatory cells are still present in their lining, suggesting persistent irritant. True cysts are not neoplastic since their epithelial cells do not show self-sustaining behavior like cancer cells. Although current diagnostic methods cannot pre-identify the true cyst, studies show bacterial infection-induced cysts can regress when irritants are removed. A true cyst like pocket cyst can regress after non-surgical root canal treatment through apoptosis, reduce inflammation and bone regeneration. While they may delay healing, they are not the cause of apical periodontitis, but a product of it. With successful infection removal, healing is possible. Residual cysts remain in the jawbone after tooth extraction with no connection to the root canal system. Inflammatory mediators, cytokines, and growth factors maintain epithelial proliferation. Regression occurs as irritants are removed, leading to apoptosis of epithelial cells. Without irritant, residual cysts shrink and may heal completely as seen in radiographic follow-up. Inflammatory apical cyst, granulomas, and abscess may persist after non-surgical root canal therapy due to persistent infection. Cholesterol crystals formed from disintegrate cell membrane can also contribute to persistent, as they cannot be degraded by macrophages, sustaining inflammation. However, most apical lesions still heal after non-surgical root canal therapy, as cholesterol crystal is considered a product, not a cause of apical periodontitis. Further research is needed to fully understand the role in the persistence of inflammatory apical cyst. So as a conclusion, inflammatory apical true cysts are biologically similar to pocket cysts and may regress after non-surgical root canal therapy through apoptosis. True cysts are not neoplastic lesion and do not require surgical removal. Since apical periodontitis lesion, including cysts, are caused by root canal infection, treatment should focus on eliminating the root canal infection rather than targeting cyst directly. Failure of apical periodontitis lesion to heal after non-surgical root canal treatment is primarily linked to residual bacterial infection in the root canal system. And thank you.